So I'll now talk to you about the clinical health psychology input. Clinical health psychology is a branch of psychology that helps people with physical health problems. So we're trying to help our patients adjust to having their condition, we're trying to support them, we're trying to minimise the impact that their condition has on their quality of life, and we're trying to promote change, and the whole team work very closely at promoting change. We're trying to change behaviour, the way you think, your mood. The whole programme is based around change. Clinical health psychology, it's not about trying to prove the pain is in your head, and we're also not trying to prove that this is imagined or you're exaggerating. All of the clinical health psychologists who work for the service are pain specialists, and we're trying to improve your quality of life despite this condition. The clinical health psychologists provide two roles. They deliver on group work and one-to-one sessions. And to give you an idea of some of the topics we'll be discussing in group work, we look at exploring change, what change means. We look at understanding pain. We want our patients to be thinking in different ways. We look at the relationship between your physical state and your emotions and your mood. We look at stress and anxiety. We look at relationships and your communication skills. When we consider we're trying to encourage our patients to change, you'll probably need to communicate that change to your family and friends, so we look at communication skills. We also help patients set and achieve goals. As I mentioned earlier, we'll also see you for one-to-one sessions if appropriate. So just to remind our patients what's expected of you, we want you to look at our code of conduct. We want you to be aware of that. This is very much a partnership, and we need you to play your part. We want you to be aware that not all of our patients complete the programme. Some patients are discharged early. For example, if you insist on being late or disruptive, or you just don't turn up for sessions, we want you to be aware that we have a right to discharge you, and we need you to be respectful of the venue, respectful of one another. We need you to know that you're only allowed to smoke in designated areas, you're not allowed to drink alcohol on the hospital site, and we want mobile phones to be switched off during each session. We also need you to let the team know if there's a change of circumstances. So for example, if you are due to have further investigations or tests, treatment, you need to let the team know, because we don't want your programme to be disrupted or interfered with. So it's always better to postpone the programme and come in at a later date than come in on week one and then have to leave early due to investigations or other medical treatment. Just to clarify what to bring with you, you'll need to bring comfortable day clothes, perhaps some swimming gear, trunks or costume, an activity perhaps to do in the evening. Patients bring in reading materials, music, work or study materials. You'll need to bring in all your dietary supplements if you take them. You'll need to bring all your medication in with labels, please. And if you're going forward to a ward admission, you might need to buy some earplugs. So what's next? There's going to be an individual assessment. You'll meet a member of the team, and then we'll have a team discussion about you. We'll produce our outcome report, and that will detail your clinical pathway. And then our administrator will contact you to give you the date for the admission. And please remember, the venue is going to be decided by the therapy team and not by the patient. And we recommend a website, that's www.paintoolkit.org, and this is a website that has pulled together many of the strategies we use on the programme, and it's very user friendly, it's been translated across the world, and we thoroughly recommend this website to you, and we look forward hopefully to meeting you when you're admitted. Goodbye.